Hi, it's Kenny here from Triscribe. Sometimes one of the big issues for you in staffing is knowing how many injections you need to give on a particular ward today so that you can manage the nursing staff to have the right qualified but very scarce resource available to give those injections, or even possibly manage down the number of injections so that it creates less of a burden on the nursing staff. In this video, I'm going to show you how to use Triscribe to answer that question. So I'm in my main Triscribe dashboard here. And for this question, I'm going to use the admin burden tile. So I click through that and I'm going to use this first tab, which is the current predicted injection levels. And you can see here that it brings up a predicted hourly injection admin level for one ward, which is the G7 ward. And I could change that. So instead of by hour, I could do it by day or by week or by month if I'd selected a longer time. Obviously, I could change the wards. And so, as always in Triscribe, to do any of that, I can do something on the chart, but I can also use the filters to narrow down my selection. And in this chart, it's very simple. All you do is select particular wards. I'm going to add a couple of wards. I'm going to apply the filters. And now you see a slightly different chart, which shows me the levels for each ward. And if I hover over, it shows me the actual numbers on each ward. Again, I could change from hour. You can see that. And if I decide that I don't want one of these wards, actually, I can just go back and click it out here. So I don't have G4 anymore. And I click out that so that I can go back to seeing G7 ward and see just that number, bring it back in, and the chart replace. Final thing we can do with this chart is simply click through to see the names of the patients who are due to receive an injection at this time or on this date. So if I click there, you'll see those 3 injections for PM Brown listed. I can't see the patient name and hospital number, of course, because Triscribe doesn't have access to that information. If you don't, then please ask your supervisor to give you the right level of access. That's it. It's a pretty simple chart, but hopefully useful. If you have any questions or feedback, please get in touch. You can also view or download a short PDF version of this guide using the link at the end of this video. Thanks for watching.